Welcome to On The Beat, everyone. I'm over here with Dr. Anna Woodson from the Dermatology Clinic, and we're talking not only about eczema, but I wanted to find out a little bit more about Dr. Anna Woodson herself. How are you, my friend?
Good,
Welcome to the show. Let's start off by introducing you to our wonderful audience. Tell us a little bit how you got into this type of work.
Sure. So initially I completed a 4-year medical school training and then went on to dermatology, which is you usually do an intern year and then 3 additional years within dermatology. I finished that in 2011.
Yeah.
And then at that point, I moved here to Columbus in 2013 and started working at the Dermatology Clinic, and have just enjoyed it. We see a variety of skin conditions. We treat skin cancers and do skin cancer surgeries.
Wow.
I see pediatrics and adults alike, and we do some cosmetic dermatology as well.
Okay, because you all told me off camera that you started in pediatrics?
I did. I initially did a pediatric residency prior to the dermatology, so I love seeing children for sure.
And I wouldn't even think that a dermatologist would be needing to see children. What are some of the conditions that you see on children as a dermatologist?
So some of the most common pediatric conditions are, in fact, eczema, which is what we talk about today. Certainly acne and common warts. So
of course, I understand. All right, well, let's get into the topic. And there is a lot of conversation around the word eczema because not everyone knows what that is. And there's all different types of remedies that they think that grandma told them, or let's go through it. What is actually eczema to begin with?
Certainly. So a patient that comes in with eczema may have quite a bit of itching. It usually shows up on their skin as a pink or red scaly patches that are usually quite itchy, and they have what we would say is a breakdown in skin barrier function, and so they're unable to retain water in their skin, so this shows up as exquisitely dry skin.
And itchy.
And very itchy. They're unable to protect themselves from infections, so they may come in with a bacterial infection or a viral infection.
Wow.
Sometimes they can think of a family history. They may think of a sibling or a parent that also had eczema.
So it could be genetic as well.
There is a genetic component, yes.
Right, because I always bring this up because I don't know why, the Kardashians. Kim Kardashian is always talking about her eczema.
Sure.
And she says it just flares up sometimes because no one in her family has had eczema.
Right.
So how is that possible?
And so, sometimes it's definitely that eczema has sort of a chronic and a relapsing history. And so there'll be periods of well and then periods of not so well. As far as the genetic component, there are some eczemas that are genetic, and then definitely irritants come into play, and that's part of our eczema therapy, is avoiding those irritants. So it may be that someone that does not have that family history is just maybe more susceptible, and they're exposed to those irritants.
And environmental, I would assume as well. And look, we don't have a lot of time, but I think you need to be able to come in and have that consultation, and then you would determine the treatment plan.
Sure.
Because is that different for everyone?
The thing is, so irritants do come into play, and avoiding triggers do come into play, and for each patient it may be different.
Yeah.
As a blanket rule, we say to avoid the common irritants, which are fragrances, heat, and smoke. But then, it may be different for you and the next person as far as other things that are their triggers.
Hence why it's important to come in for that consultation.
Yes.
We appreciate you.
Thank you for
stopping by.
Yes.
I love learning about other skin conditions that I don't know a lot about. If you want to find out more about Anna Woodson, Dr. Anna Woodson, I should say, the Dermatology Clinic, all the information is up on the screen. I love the conversation about eczema. Back after this short break.